Fluid around your heart can slightly kill. Do you know about that condition? This is called pericardial effusion. That is, fluid buildup in the sac around your heart. If it is in small amount, there is no problem, but rapid or large accumulation can lead to cardiac tamponade. Classic signs include Beck's triad, and this is one of the most important examiner's favorite viva question. So please remember this. It includes hypotension, raised DVP, and muffled heart sounds. And patient may also have chest pain, breathlessness, and tachycardia. If tamponade persists, heart cannot fill, so it can lead to shock. And don't forget to follow Medics Fortune for more simple medicine related learning. Thank you.